Though that breaking news affecting all of North Carolina soon now, about 90 seconds, Governor Cooper is expected to drop the stay-at-home order and enter a next big phase in reopening.
Yes, and of course, we plan to bring you that announcement live as soon as he comes to the podium. But first, let's go to Channel 9's Damani Lewis breaking down phase 2 and exactly what we could expect. Damani?
Well, Erica, this is the most significant change we've seen since North Carolina went into its stay-at-home order back in March. Now, phase 2 is a big deal. Now, here's a look. First, it officially lifts the stay-at-home order, though vulnerable people will still be asked to stay home. It will allow limited opening of restaurants and bars, but only to 50% of capacity, and they have to follow rules like keeping tables 6 feet apart. And we'll also see close contact businesses open. That means salons and barber shops under strict rules. Now, you'll also be able to go to the gym, and kids can play on the playgrounds once again. And even entertainment like theaters will be open. Now the governor will make it official, but we expect all of this to start on Friday. Now, how do we get to this point? Well, North Carolina had some key metrics to meet. A reduction in confirmed cases per day. And we're told Governor Cooper now is taking to the podium right now. So let's listen in.
Good afternoon, everyone, and thank you for joining today's update on COVID-19 in North Carolina. As of today, our state has 20,015 confirmed cases, 554 people in the hospital, and sadly, 699 deaths. This virus is still a serious threat to our state, but North Carolinians have made changes and sacrifices in their daily lives, and that has helped to flatten the curve here. That means hospitals and the medical system can serve sick patients effectively for all kinds of illnesses, including COVID-19. Last month, we laid out a phased approach to easing restrictions in our state that relied on data, science, and facts. 2 weeks ago, we announced that we were entering phase 1. Today, we're announcing another gradual and cautious step while still keeping important health and safety measures in place. We've been closely watching and reporting the North Carolina data on a daily basis, but it's important to watch the trend lines over a 14-day period to determine if our metrics are increasing, decreasing, or stable over time. Today, Dr. Mandy Cohen, Secretary of the Department of Health and Human Services, will walk through the status of our key indicators, and I'll ask her to come do that now. Dr. Cohen.
Thank you, Governor. I'm grateful for your commitment to ensuring our state moves forward responsibly based on science and data. Your leadership and the collective efforts of North Carolinians have prepared us to move into phase 2 at the end of the week. I'll go through the graphs and you'll see that overall the trends have been stable, but the data also shows us that we need to be cautious and stay vigilant to continue to slow the spread of the virus. As a reminder, we look at a combination of trends that guide our decision-making, including looking at COVID-like syndromic cases, lab-confirmed cases, positive tests as a percentage of total tests, and hospitalizations. These indicators were chosen based on public health data as well as White House guidance. We cannot look at any one of these metrics in isolation. We really need to see them as a whole package when making decisions, and each of these data has limitations. On this first graph, we look at people who have come to the emergency department with COVID-like symptoms. This metric serves as an early detection mechanism. I want to draw your attention to the yellow line, and you'll see towards the right, it is decreasing, and this is good news. When we look at laboratory confirmed tests, and you look at the yellow line, you will see that they are increasing. And although today we had a lower daily new case count with 422 new cases, last weekend we saw our highest single-day increase with 853 new cases in one day. This indicator needs to be interpreted in the context of the additional testing we are doing across the state. We know that as we do more testing, we expect this indicator to rise. But this increase in case count also shows us that the virus is here in our communities across the state. I would have liked to see this trend starting to level, but it has not yet done that. Now, on this next slide, we look at the percent of tests that are positive. And it's important to interpret the last graph you just saw and this graph together. I want to draw your attention again to that yellow line, and you can see that the percentage of total tests that are positive has been decreasing and is starting to level. So, while we're seeing more positive cases day over day, as we saw in the previous graph with the increasing testing, the percent positive continues to look very good. On our next slide here, this is our metric of day-over-day hospitalizations. This yellow line shows that North Carolina's trajectory of hospitalizations is level. We have the capacity to meet increasing demands if more people become seriously ill. That's also really good. If you notice to the right-hand side of that graph, those last few bars show a slight uptick in the past few days. So we'll want to continue to monitor this trend closely, but overall, we are stable on hospitalizations. Finally, a bonus graph again today, providing an update on where we are with testing. Again, looking at the yellow line, you can see that this trend is up. Good news. In the past week, we've made significant progress expanding testing, ranging from between 8,000 to over 12,000 tests a day. This is really good progress. All right, so here's where we are today. Our surveillance data shows a decline, green check. North Carolina's trajectory of laboratory-confirmed cases continues to increase. That gets a red X. This rise can be expected as we are doing more testing, but it also signals that we need to take a cautious approach to phase 2. North Carolina's trajectory in percent of tests returning positive has been decreasing and starting to level, which is good news. This gets a green check. North Carolina's trajectory of hospitalizations is level, and we have hospital capacity, so that is very good, also gets a green check. In terms of our other capabilities, we continue to see great improvements. As I just mentioned, we're doing a lot more testing, and we have posted lists of testing sites on our website that will be updating on an ongoing basis. As of today, there are over 300 sites listed across North Carolina, but there's more to do. We're working with counties as well as partners from the private sector to continue to expand access to testing across the whole state. Our work in contact tracing is advancing, and the Carolina Community Tracing Collaborative has hired 152 new tracers. We're also being very intentional that the tracers who are hired reflect the diversity of the communities they serve. We have now posted on our website the demographics of those contact tracers hired to date. These staff will help support our very strong local health department folks who are experts at contact tracing. So based on what we're seeing in our testing, tracing, and trends, we are moving to phase 2, but we need to move in a more cautious way. Our rising case counts indicate that we need to take a more modest step than we would have originally planned. We need to be incredibly vigilant to slow the spread of the virus. I want to include by noting that our team launched an updated COVID-19 dashboard on the DHHS website today. The interactive dashboard provides an overview of the metrics I just covered, as well as the other capabilities that the state is following to inform our decisions to responsively ease measures that slow the spread of the virus. The updated dashboard includes an enhanced North Carolina map, sections on COVID-like illness surveillance, cases, testing, hospitalization, contact tracing, PPE, and congregate living settings. Keeping our trends stable still depends on your actions, what you do to protect your loved ones and your neighbors. Remember, people can have COVID-19 and not have any symptoms. If we don't practice the 3 W's, wear, wait, and wash, we can unknowingly expose people to the virus. When we wear a face covering, wait 6 feet apart, and wash our hands often, we show our families, friends, and neighbors that we care about them. So remember, wear, wait, and wash. Thank you, Governor.
Thank you, Dr. Cohen. Appreciate your leadership, and we're grateful that you have put these numbers together, and it's something that the people of North Carolina can see for themselves. So, because this data shows that we can, North Carolina will move into a Safer at Home Phase 2 on Friday, May 22nd at 5 p.m. Phase 2 is another careful step forward. Since we announced Phase 1, the state's overall key indicators remain stable. However, the increases in the COVID-19 cases signal a need to take a more modest step forward in Phase 2 than originally envisioned. While I am lifting the stay-at-home order, we are shifting to a safer-at-home recommendation. And that's especially important for vulnerable people who are at risk for more severe illness. Teleworking, when possible, is also highly recommended. Safer at home means just what it says. Just because you can go more places doesn't mean you always should. Now, some businesses and places will remain closed in Phase 2, including bars, nightclubs, gyms, and indoor fitness facilities, indoor entertainment venues such as movie theaters, bowling alleys, and museums, and public playgrounds. This is because the potential spread of COVID-19 can be significant there. The mass gathering limits in Phase 2 will be no more than 10 people indoors or 25 people outdoors. And this applies to event venues, conference centers, stadiums and sports arenas, amphitheaters, and groups at parks or beaches. When people gather together, one person can be the spark to spread the virus to many. Now, certain businesses will be able to open at limited capacity with other requirements. Restaurants can reopen for dine-in customers at mostly a 50% capacity with distancing and cleaning requirements. Personal care businesses like salons and barbers can also reopen at 50% capacity. These businesses will have face covering and cleaning requirements while also reducing the number of people in the waiting areas. Swimming pools will be able to open at 50% capacity, and overnight and day camps can open with safety rules. Child care facilities remain open and are now able to enroll all children. I want to thank our child care centers that have been open. They've been taking enhanced precautions and they've been providing a critical service. As with previous orders, these restrictions are a floor. Local governments may enact more strict rules if health officials and local leaders believe it's in their best interest and in the best interest of the health of their communities. Now, this next phase can help us boost our economy, and that's important. But we can only help our economy when people have confidence in their own safety, which is why it's important to ease restrictions carefully and use data like Dr. Cohen was talking about in deciding when to do it. Now, I know this virus has upended life for many North Carolinians, especially those who've lost their incomes. And I've directed the Division of Employment Security to improve the efficiency and customer service of the unemployment benefits process. In Safer at Home Phase 2, the 3 W's are even more important. Wash your hands frequently, wait 6 feet apart from other people, and wear a face covering. Remember, the face covering is more about protecting other people from your germs in case you have the virus and just don't know it yet. A face covering signifies strength and compassion for others. Wearing one means that you actually care about other people's health. And I'm proud every day here at the Emergency Operations Center when I see our brave National Guard soldiers and tough Marine Mike Sprayberry using them. Finally, I'd ask us all to be patient and understanding of the frontline heroes who are running cash registers, driving delivery routes, and helping customers, especially those businesses that will just be opening this weekend. Not every restaurant and salon will be able to open Friday evening, and some may choose not to open at all. Show them the courtesy of patience as they weigh how to best serve their customers and to stay safe. We owe that to them. And let's keep looking out for our neighbors, thanking our frontline workers, getting some fresh air when we can, and working together to defeat this virus. With me today is Dr. Cohen, our Secretary of the Department of Health and Human Services. Our Secretary of Public Safety, Eric Hooks, is with us, along with Director of Emergency Management, Mike Sprayberry. Karen Magoon and Nicole Fox are our sign language interpreters. And behind the scenes, Jackie and Jasmine Mativier are our Spanish language interpreters. So we're questions from the media, and if you could identify yourself and your organization when you call in, we'll take the first one.
Our first question will be from Colleen Quigley, WNCN.
Good afternoon, Governor Cooper and everyone. Thanks for taking my question. It's in regards to local law enforcement leaders in past saying they wouldn't enforce parts of your executive orders. What is going to be your message going forward when asking people to keep their businesses, their bar, their restaurants, their salons at 50%? How are you going to make sure that's enforced?
Most of law enforcement across this state is doing what they should do and are enforcing the law, and they're doing it in a good way. They're telling people about the order, they're taking complaints from people, and they're going to see people who may be in violation of the order. And most North Carolinians are doing their best to follow the orders and doing their best to keep their families and their neighbors safe from this virus. I believe that most of the law enforcement in North Carolina want to keep people healthy. And I think many of them will welcome this cautious move into phase 2. One of the things I've heard from a lot of people is that we need to get our restaurants open and our personal care salons, people getting haircut, those kinds of things. That's going to happen now, and it's going to be done in a safe way. So we hope that everybody can stick together, look out for each other, and that most people will follow these orders and will do what they need to do to wash their hands and wear a cloth face covering and wait 6 feet apart from other people. We've still got some work to do in slowing the spread of this virus, and we need to all stick together to try to do it. Thanks. Next question,
All right,
please.
You've been listening there to North Carolina Governor Roy Cooper officially lifting the stay-at-home order, but implementing what he calls a safer at home order in phase 2, and also saying we will go to phase 2 of reopening on Friday at 5 p.m., but calling it a more modest step into phase 2. But this is the announcement that many people have been waiting for because restaurants, salons, barbershops, pools can reopen, Erica, but still bars, nightclubs, gyms, public playgrounds and bowling alleys will stay closed as of Friday.
Yeah, they talked about the wear, wait, and wash, reemphasizing that and saying that just because you can go out doesn't mean that you should. Everybody has to make those personal decisions. We do have a team of reporters to take you through the impacts on things like restaurants, salons, barbershops, and even your entertainment as we move into phase 2. Want to start live with Channel 9's Mark Becker. Mark?
Yeah, Erica, here at Restaurant Land, you can almost hear the collective sigh of relief. The restaurant dining room here at Harper's at South Park has been closed for more than 2 months now, while everybody was ordered to stay at home. And the owner today told me this comes just in time. He's really wanting to get his employees here and at his other restaurants in town back to work. Of course, he has to do it all, as the governor said, cautiously, safely, with that 50% capacity limit and new regulations about safety, cleaning, and distancing inside the restaurant. All of that while still making a profit. It won't be easy in an industry that has razor-thin profit margins to begin with. Now, it won't be easy for other industries as well. Folks like barbers and salon owners have the same challenges. And today, my colleague Deshaun Brown has been speaking with some of them. Deshaun?
Yeah, Mark, I did. I spoke with several salon owners, or have heard from several salon owners, and one thing that I've heard from them is there really is no one-size-fits-all solution on how to reopen. One of the owners works in this suite, and one of the things she mentioned was the challenge with PPE. You heard the governor reference face mask when you come to have a salon service done. She says they still had a challenge even getting that. And you got to keep in mind, so many salon owners and barbers, others in the beauty industry, spend so much time in close personal contact. But there is also the issue of just trying to pay the bills. That has been another major concern for several salon owners and others in this industry. They do now have the option on whether they want to reopen, but I am learning today not all of them will. I do want to toss it over now to my colleague Blaine Tollison for a look at how this will impact the entertainment venues.
Deshaun, venue owners trying to navigate this as well, with many of them across Charlotte still not having hard dates on reopening just yet. You can imagine how hard this must be for them. They don't have tables and chairs to make people maintain social distancing. I'm here in Notus under the neighborhood theater awning, and behind me you can see the Evening Muse, where the owner there told me that they are looking at things like hand sanitizer stations, thermometers to check people, as well as masks. He says that he would like to maybe work with the city of Charlotte as well as other local independent venues on a plan. As far as your massive venues like PNC Pavilion and the Blumenthal, they are banding together with Live Nation and other large venues to come up with a plan. It's still up in the air, but they did mention some things like temperature checks and having audience members arrive in a staggered fashion to those venues. Lots of interesting ideas out there, which I'll get into more shortly. Erica?
Thank you, Blaine. Want to also let people know about South Carolina's Governor Henry McMaster coming on at 4 o'clock. He continued to ease restrictions in the Palmetto State with his announcement, announcing that outdoor youth and adult sports like softball, kickball, flag football, they can start again on May the 30th for practices only. He said teams will not be able to enter a competition state until mid-June, June 15th. Places like museums, arcades, and bingo halls will be able to reopen this Friday. Each facility has specific guidelines that must be followed with their reopening.